Okay, good morning. We're going to go ahead and get started. I'm Dana Edson. I'm the Executive Director here at SARCOA, and we welcome you. I think Jacqueline Shope and Deb Hodgett have a great program lined up for you today, and we hope you have learned a lot of new information and that it will be helpful. So did you know that 53 million Americans are unpaid caregivers just like you? And between 2015 and 2020, that number grew by 10 million. And I'm one of those 10 million. My two sisters and I, we care for elderly parents, a 94-year-old and an 85-year-old. So I understand the need for this type of training. So, again, I think we're going to have a really informative agenda today, and I hope you're going to learn lots. Thank you. Deb?
Thank you, Dana. Dana is our Executive Director. We want to thank each and every one of you for coming here today. We don't always prepare for our role as caregiver, and we hope that this first caregiver event at SARCOA will equip you with better management skills, better coping skills, and self-care, which is so important when you're caring for somebody else to take care of yourself. Like I said, this is the first time we've offered this at SARCOA to the public. Hopefully, if you all like it, we are going to offer more of these events in the future and cover other topics. That's why it's so important for you to fill out your evaluation at the end of the event so we know topics that you care about so we can have other events that expound on those things. We hope that this event will help you with your journey, caregiving journey. There's a few housekeeping events that we need to take care of before we get started. First is a smoke-free facility, and something that's very important. If you can all just turn off your cell phones or put your cell phones on vibrate, so when the speakers are giving their presentation, we know that nobody's ordering a pizza or anything like that. So that's really important to do. One thing that's very important is our restrooms. So we do not have restrooms up here. If you go down the elevator and you go to your left and your left, you'll see our restrooms. We have a sign down there that says restrooms once you make the second left, and they're right there for you. There are going to be 2 breakout sessions in between speakers. If we don't have time to do Q&A, if the speakers go their full 30 minutes, you can ask them more questions during the breakout sessions. We encourage that. Probably most speakers won't go a full 30 minutes, so when they're done speaking, if you want to raise your hand, I'll bring the microphone, or one of our volunteers will bring the microphone to you, and you can ask your questions. There will be door prizes awarded. So we'll have Judy back there. She will award the door prizes. I think you guys all got tickets, and so we have 3 of those, each before the breakout session and at the end of the last speaker. Also, there will be a video link sent out to you probably next week. We are recording this event, so if you miss anything on your notes, don't worry. We will have a video link for you. Oh, and one thing that you guys might not notice is there are bags on the back of your chairs. There's just so much swag here today. So thank you to all our sponsors and speakers, and we hope that you learn a lot at Caregiver College. Thank you.
Thank you, Deb. Hi, everybody. I'm Jacqueline Shope, and I am the Alabama Cares Coordinator with SARCOA. So in your time today, please take a look at the Senior Resource Directory. You'll find more information. Is this working? Can you hear me? Okay. You'll find more information about the Alabama Cares Program, the requirements, eligibility. Please mingle with us, network during this day, and we will give you all of the information we can on all the resources here at SARCOA. At this time, I would like to introduce Ms. Libby Harper. She is from the Center for Vein Restoration. She's going to be talking about leg problems, vein problems, and those causes and treatments.
Yep. Thank you. Good morning.
Good morning.
Okay, does my voice project?
It does.
Many years as a mom. Before cell phones. When you had to holler for your kids. Okay, like she said, my name is Libby Harper, and I work at Center for Vein Restoration. I've been with them for 13 years. 8 of those years I was a vascular ultrasound tech, which means I scanned people's legs looking at bad veins. And then the last couple of years I've been working as a community outreach coordinator, where I go out into the community and I educate people about their legs. I discovered when I first started doing this back in 2008, nobody knew anything about veins. Everybody's focus is on arteries, as it should be. Arteries are very important, gotta have them to live. But just as important are the veins. And unfortunately, a lot of doctors don't know very much about the veins. You think our doctors are taught all this in school? Veins are not taught very much. They touch on it just briefly. It is a very newer area of medicine, very up and coming. Our company has over 150 new clinics around the United States, Alaska. You know, it's growing very, very rapidly because what we do is so important. About 95% of what we do in our clinic is medical. It is not cosmetic. We've gotten that funny thing in our mind that, oh, the veins are just, I don't like my legs looking so, ugly with the veins, so it's a cosmetic problem. No. What I'm going to do today is I'm going to talk you through veins from A to Z, how they work, why they do what they do, what happens when they don't work correctly, some things you can do to help yourself, and if you do have problems with your veins, what's some of the things we can do to help you? So let's start off. First of all, I'm going to go over real quick some of the myths that are out there about veins. Like I said, vein treatment is for cosmetic purposes only. I have heard patients come in and say, oh, my doctor said don't bother going there, they're just going to treat your spider veins and that's it. We do treat spider veins. That is cosmetic. Some people want it. That's fine. No problem. That's a very tiny percentage of what we do. A lot of people think insurance doesn't pay because they have that mindset that veins are cosmetic, so therefore insurance isn't going to pay. Incorrect. Any patient that walks through the door has to have a full ultrasound done on their legs, where we scan the deep veins, we scan all the superficial veins, and we look for problems. Insurance knows we have to do that in order to give you a correct diagnosis and a correct treatment. Insurance pays for that. So when you, minus your copay and your deductible, but insurance, we file it on everybody's insurance, and we take across the board, there's like 1 or 2 off the wall, I've never heard of kind of insurances that we may have a little problem with. But we have a corporate office up in Maryland who has a big insurance department, and they work with the insurance. And if we find a company we're not in network with, they work when trying to get in network with them. So we take across the board insurances. We are part of the military, so we take TRICARE, we take VA, all that. So there's no excuse not to come. Okay, some people think you need a vascular surgeon. Now, some doctors will, if the patient's having like bulging veins and having problems, they hear vascular, so they send them to a vascular surgeon. That is not what you want. A vascular surgeon handles the arteries and the veins, but 98% of what they do is arteries. They're the ones that are working on the big veins, doing the major stents, all that kind of stuff. They don't deal with veins, just the leg veins, the bulging veins, and all that. Our doctors are all MDs. It's not, not just an overnight class, where you get your certificate set. They're all MDs, and they are trained specifically in phlebology, which is the study of veins. So that's why we differentiate. We don't touch arteries. We don't do anything with arteries. We focus on the veins only. So if your doctor says, oh, I'm going to send you to a vascular surgeon, think surgeon is going to operate. No, 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 no. You don't want that. You want to come to us, and we will be the ones that focus on your veins and can treat you correctly. Everybody here, well, I hear this a lot. Well, my doctor just puts me in compression stockings and says that should help. Yes, it does help, but you're not curing anything. And I'll talk more about stockings in a minute. So, I mean, compression stockings, do you want to live in those things for the rest of your life? No, I don't. I've worn them. I've had procedures done on my legs, and I've worn them for the week afterwards. They're not pleasant, so if I could get out of them, I sure want to get out of them. So you don't want that to be a life sentence for you, to have to wear those for the rest of your life. Ulcers only need wound care. Now this is, I'll get more, this is my soapbox that I will climb up on top of, and I will, because I have seen it. In the 8 years that I scanned, I have seen so many people mistreated and not misdiagnosed, but just sent through the cycle of wound care. Wound care is a wonderful facility. They do great work. I wouldn't touch it with a 10-foot pole. That's not my area. So they do good work. But ulcers need to be diagnosed, not just treated. And there's many different reasons for ulcers. So you can't just say, oh, you've got an ulcer, go to wound care, because then they're not treating what's causing the ulcer. They'll treat the ulcer and make it disappear for a while, but if you don't get the right treatment to begin with, it's going to come back. And last but not least, I get this so many times. My daughter, who's in the back here, and I have done numerous events, and we get men that come up to us all the time and say, oh, you work on veins, I don't get those. Men don't get those. And my pat answer is, do you have blood in your legs? Yeah? Then you can get them. Anybody that's got blood moving through their legs can get bad veins. Okay, so that's the myths that surround veins. Okay, how do veins work? Let's get this whole picture going. Okay, our heart pumps about 80,000 times a day, moving about 2,000 gallons of blood. That's a lot of blood. If you will open up, did you guys pass the folders out yet? Okay. Open up to page 6. I'm sorry, I had my thumb on the wrong page. There is a diagram on page 6 of a leg. The light blue vein that you see in the leg is the deep vein. The darker blue veins on the leg are the superficial veins. They all work together, moving the blood from the foot back up to the heart again. All the tiny veins, and of course obviously they get smaller and smaller where you can't see them, these are just the major ones. They all go from little and dump into bigger, dump into bigger, dump into the light blue, and then the light blue, which is the femoral vein, is what takes it back up to the heart and lungs. So it's all one system. So when I say deep vein, I'm talking about that light blue one. We don't treat that. That's the mother lode. We don't want to treat that. You don't want people treating that, because that's the way the majority of the blood gets up out of your leg. You have hundreds and hundreds of veins in your legs of the dark blue, the superficial veins, and you can treat those, and it does not affect the leg, and I'll explain how in a minute. Okay, the superficial veins, the dark blue ones, only carry about 20% of your blood back to the heart. The deep vein is the one there's connectors that connect all the little veins to the big vein, and it's moving stuff up the leg. Okay, if you will look on page 4, switch to page 4, and you will see a little thing in the corner up in the top left, on the left page. And that's a picture of inside the veins are valves, one-way valves that open and close with muscle contraction. The heart beats. You know, obviously our heart pumps all the time, never stops. So every time our heart compresses, it's pumping that oxygenated blood out to the tissues. Every tissue in our body has to have oxygen. So the blood goes out through the arteries. The arteries are what carry the oxygenated blood out to all the tissue. Once that oxygen gets dropped off into the body, happens in the capillaries, which are microscopic. You can't see them without a microscope. Then the capillaries pick up the waste product, which is the carbon dioxide and all the waste product that the muscles burn and use. And then the veins' job is to bring all that waste product back up to the heart and lungs, where we breathe off the carbon dioxide that the body picked up, take in more oxygen. It goes through the lungs, gets more oxygen that way, then the heart pushes it out. So it's a big circle. Arteries take it out, veins bring it back. Great system. The only flaw is in our legs. Because we are creatures that stand on our feet or our feet are on the ground 90% of the day, that liquid has to go upstream. So God in his infinite wisdom created us with one-way valves that open and close to keep that blood going upstream. Every time you move your foot, every time you take a step, you do the gas pedal movement, anything like that, your calf muscle is your secondary pump. So this is where you can help being caregivers and for yourself is get those calf muscles moving. That is the only way liquid gets out of the leg. Lymphatic fluid, blood, all of that stays stagnant in the foot and ankle and leg if you don't move your calf muscle. Your heart's your primary pump. Don't have to think about that one, but you got to think about your calf muscle. It has to pump to push that liquid upstream. So if you look at that picture, the first arrow going up, that's the calf muscle squeezing and it forces the blood up and the valve opens up. Then the muscle relaxes and the valve snaps shut so the blood can't come back downstream. Next time your calf muscle pumps, then it moves further upstream. So obviously, the more we move our feet and legs, the healthier our legs are because we're moving the fluid out of the leg. So walking is so good. Even if it's not, you don't have to be a speed run. It doesn't have to be a hard walk. Just getting up and walking to the bathroom or walking to the kitchen. If you can't get up too well, do like the gas pedal pump, move that foot and ankle. That's what's pushing the fluids out of the leg. And so that is, the second picture there is showing when those one-way valves break down, and that's where the trouble lies, is those one-way valves. If those break down, the blood goes up okay, there's no problem going up, but then the valve doesn't close and meet, it's gotten loose and floppy, so the blood comes back down the leg. Now you've got multiple valves, so it's all compartmentalized. So you've got a section where the valve doesn't work. So it goes up to the next section, and that stays fine, but the blood coming up behind it gets to that section where it's not working, and it just goes right back downstream again, slams down on top of the next valve downstream, and over time, breaks that valve down. And meanwhile, when you're stationary, if I stood here for a while, your heart never stops pumping, so it's always pushing blood out to the arteries, arterioles, the capillaries, that's the system, and then from the capillaries to the venules to the veins and back. Well, if I'm not moving my calf muscle, there's a buildup in my feet and ankles. The blood's coming down, the artery's working fine, but I'm not doing my job to get it out of there. So when that valve doesn't work and I take a step, that blood goes up, but then it goes boom, right back down again. And when I'm stationary, since more blood's coming from the heart side, it fills that vein and stretches it out and gets bigger and bigger. Well, those valves, even the healthy ones, get to where they don't even meet anymore because the vein gets stretched out. So even if you've got healthy legs, healthy veins, you gotta move your feet. You are just helping your whole system by moving your legs, getting that calf muscle pumping. Okay, so let me grab a sip of water here, sorry. Okay. Now, venous reflux. That's what you'll hear at our office a lot. Venous reflux is just a fancy way of saying the blood doesn't go the right direction. It just means it's coming back down the leg. The whole system is nothing but a plumbing system that's fighting gravity. It's not that's that simple. It is just liquid that's trying to go upstream all day. And the check valves sometimes don't work in some people. And so we're here to help you figure out, A, if you have a problem, B, if you do, what do we do about it? So it's not first time I started doing veins, I was like, this isn't rocket science, it's just liquid trying to go upstream, and the system that's in place doesn't work quite well. So venous reflux, all it means is the blood is going back away from the heart, the blood's trying to get back up to the heart and lungs in the veins, and if you have reflux, it just means it's going the wrong way. Who has acid reflux? I do, I have to take, and it means the acid's coming back up the esophagus, right? You usually take medicine for it, don't eat spicy foods, yada yada. Reflux just means going the wrong direction. So if you have acid reflux, it means the acid's coming up the esophagus. If you have venous reflux, it just means the blood's going back down a leg in a vessel where it's supposed to be going up and not down. Okay, now, on the next page, over on page 5, you'll see the early signs of vein disease. Aching and pain. A lot of times that gets attributed to so many other things. Knees, knee joints, strain, muscle strain, so it gets masked a lot of times. Varicose veins, the bulging veins, that some people have, not everybody has them. Spider veins. If you have a spider vein, you have a varicose vein. Varicose veins are not simply a vein that the valves don't work. The blood has engorged that vessel to the point where you can see it. So a spider vein is a varicose vein. They are one and the same. It's just the diameter is so tiny, we think of it as, oh, that's just a little cosmetic thing. That is showing us you have vein disease. It's showing us the valve inside those little bitty veins aren't working. So there's a good chance in the bigger veins, even though you may not see them yet, their valves aren't working. You can only discover it through ultrasound. Now, some people come in and have bulging veins all over. You can go, okay, you got varicose veins. We know that. Some people don't. I'm going to call my daughter up real quick. This is my daughter, Olivia, who's 27. I was bored one day. Like I said, she comes to a lot of my events with me, and it got to be a slow period, so I decided to scan her legs. I have vein disease. Her father has vein disease. He and I both have had procedures. I scanned both of her legs. Now, would you say she has problems?
On either of her legs. They're completely smooth.
Nothing. She doesn't even really have spider. She's got one little spider vein in the back of the calf. She has venous reflux in both of her legs. You can't tell, but I found it on the ultrasound because the ultrasound, I'm looking at the bigger vessels. Varicose veins get worse over time. The original disease process usually starts in the 20s, teens and 20s, and it's a gradual process.
Because you scanned my legs. I didn't even have a spider vein at the time.
Yeah.
And now I'm starting to get one.
Yeah, so she's going to, at some point, we're going to get around to that.
Thanks.
But thank you, Olivia.
No problem.
And so it's just over time, what happens is these veins stretch and get bigger and bigger and bigger to the point where you can start to see them. And so then people are like, oh, I think I have a vein problem. Oh, you had a vein problem 20, 30 years ago. It's just now it's visible. A lot of people have the symptoms before then. Their legs ache, feel tired and heavy. They feel like, oh, I just can't take another step at the end of the day. You know, you do this, but everybody attributes it to knees and backs and everything else. A lot of times it's the vein that's causing the pain and the aching. Burning, and you can get an itching and a burning in the leg. Restless leg has been attributed to, not all the time, but there's a lot of times that restless leg has been attributed to veins, and the symptoms have stopped once the vein has been treated. Throbbing, heaviness, dry skin hot to touch. If you will look at those pictures on that page, those are the different stages of vein disease. The first one shows little spider veins, little patch here, a couple there. Some people have horrible spider veins all over their legs. Second one is the bulgy vein, the varicose vein. That's the mother lode that we think of usually. The third one is swelling. A lot of times people will only have vein trouble in one leg. We don't know why, it just does. So left leg could be totally normal, right leg just be awful. So if you have swelling in one leg, or if you have vein disease in both legs, you can have swelling in both legs, but just don't think, oh, it's only in one leg, so it can't be veins. Yes, it can be one leg only. It can be both legs. Skin discoloration. How many people have seen or are taking care of someone who's got that kind of redness down on the lower part of their leg? Or actually, over time, it'll start turning brown and start looking leathery. If you go to Walmart in the summertime, you'll see people walking around with this, and I think, I want to go up and say, you don't have to be like this, there's help out there. That is the skin breaking down from the veins. Then there's venous eczema, which is where the skin gets really dry and flaky. And we've had it to the point where people have flaked off so bad that the liquid in the tissue leaks through and their legs just leak liquid because there's so much fluid in their legs. And then a venous ulcer. Let me explain the steps and how this works so you've got a better picture. And this is for yourself and for the people you give care to. If you see any of this or have any of this or know anybody, please let them know there is help out there. When these veins stretch, when that blood comes back down and pools in that vein and it stretches and starts getting bigger and bigger, the vein wall gets pulled apart. The muscle cells in the wall of the vein start to separate. The vein isn't going to rupture. It's not like blowing up a balloon and it's going to pop. Sometimes the little ones, the little spider veins do, and that's sometimes you'll feel a burning and you'll get like a little sudden bruise under the skin. A lot of times that's a spider vein breaking. The bigger veins are too thick. They're not going to pop, but they actually pull the wall of the vein apart and the muscle cells separate. And it makes holes in the walls of the vein. It allows the liquid part of the blood, the serum part, to leak out of the vein. Where does that liquid go? Because our feet are on the ground. Down to our feet and ankles. So that's why we get swelling at our feet and ankles. That liquid has a lot of enzymes in it. And the body sends in the white blood cells to break up those enzymes, reabsorb that, put it back in the system where it's supposed to go, and then move it along. Unfortunately, the vein is leaking 24/7. So it's always got an agitation in the tissue down there, and the body's always sending in the macrophages that chew up the bad stuff, white blood cells, to reabsorb it. Well, over time, it actually starts to eat the skin from the inside out. And that's why you get the skin discoloration. That's this white blood cells eating up the skin from the inside to the outside. And it will keep eating it until it makes a hole in the wall of the skin. And that's when the ulcer develops. Doctors send patients to wound care, like I said earlier. Wound care treats the ulcer. They scrub it out, they put you on antibiotics, they put you in Uniboot, they do all this stuff to it, but you still got that leaking vein in there that's causing the problem to begin with. You have to treat the vein, shut the leak off, so the body quits sending the macrophages down there to eat up the enzymes and protein. If you don't do that, the ulcer may go away for a little bit, but it's going to come right back with a vengeance. Now, there are other ulcers. There's diabetic ulcers, there's arterial ulcers. But if you don't do an ultrasound and rule out the veins, you don't know which one you're dealing with. So you've got to come and have the ultrasound done. Let us see if it's a vein problem. We have had such great success with people getting the veins treated and the ulcers disappearing and staying gone. You think of how many years some people are in wound care. Thousands and thousands of dollars spent on wound care when it's a procedure that can be done in 15 minutes and you're up and walking. So a lot of money is wasted, and because a lot of doctors don't know, they just send you to wound care. So that's what my job is, to educate the public so you know you have options out there. Okay, now, on to the next page. Real quick, I just want, how much time do I got? Oh, couple, hurry up. I could talk all day about this. I'm so passionate. Okay, over 30 million people in the U.S. are affected, but only about 1.9 million get treated. So there's a lot of people out there that have vein disease. It is primarily genetic. If you have a parent that has veins, bad veins, one parent, two parent, grandparents, aunts, uncles, blood directed, then there's a very good chance that you are going to get them too. If you have one parent, you've got about a 50% chance of getting it. Two parents, it jumps up to about 90%. My 90% child back there, because both of her parents had it. So it is, and it doesn't, a lot of people say, well, my parents' legs look fine. They may have had it going on and theirs just never got to the point where it stretched out. You can think it can skip generations where the parent's carrying the gene, the parent is carrying the gene and comes together, and guess what? Bam, you got it. So just because you don't see anything doesn't mean you don't have it. Real quick, blood clots. Big fear, right? Everybody worries about blood clots, especially when our parents become more inactive. I take care of my mom who's 93, so I understand. There are two types of blood clots. Most people don't know this. There is a DVT, deep vein thrombosis. Remember the picture I showed you with the light blue and the dark blue veins? DVTs happen in the light blue vein. That's the deep vein. That's the ones we worry about. Piece breaks off, can go to the lungs, pulmonary embolism can kill you. We take that very seriously. We check for those all the time. When you come in, new patient visit, we check the full deep vein. We do a better job than the hospital does because we do a more extensive job. The other vessel that can get occluded is the dark blue veins. And those, if you get a clot in one of those, that's an SVT. So you've got DVT, which is deep vein thrombosis, SVT, which is superficial venous thrombosis. All it means is you've got a blood clot in any other vessel in the leg other than the deep vein. These are not ones we worry about. These are not the kind that break off and go to the lungs and cause pulmonary embolism. We do worry about them in the fact that they're extremely painful. I'm going to throw out an old term. Does anybody remember phlebitis? We don't use that term quite as much. Phlebitis was a clot in a superficial vessel. It would get red and hot, usually kind of swollen, can be kind of hard to the touch. You don't want anybody to touch it because it hurts so much. That is a blood clot in a superficial vein. That is not going to kill you. Okay, so just if you ever hear them talking about blood clot, make sure you know if it's a deep blood clot or a superficial. So you just want to make sure one is bad, one is okay. So now she's given me time warning, and I am so sorry that I've got to keep this moving. So I will be back there for more questions too. What do? We treat the veins at our office. That vein that has the valves that's not working, we close those down because they are not moving the blood through like it's supposed to. So we go in through there, and if you will look on page, let me find my page here, page 10, there is a picture at the top up here on the left-hand side, and we determine which vein is bad and not functioning correctly. They numb up an area, you're wide awake, we don't put anybody to sleep, so you don't feel anything, because we numb the area, but we don't want to put people to sleep because anesthesia is so dangerous, especially as we age. So they numb up that area, they put a catheter, like an IV, same thing, inside the vein, and then they close the vein from the inside to the end of the catheter, pull it out, hold pressure, and then they wrap it. They will put you in a compression stocking for a couple of days just to put pressure on that vessel. And then they send you out to walk, because walking is good. We want everybody to walk. And then you go about your merry way. That is all there is to it. You do have to come back for follow-ups, just we check with ultrasound and make sure nothing's going on. There are no stitches, no downtime. We don't want you off your feet. We want you on your feet moving because you have a higher chance of developing a blood clot if you're not moving. So we want you up and moving and getting out there and going. So that's part of our healing process, is getting on your feet and going for a walk. So anything we do in the office, we're going to tell you to go walk. We have had people who don't ambulate very well. That's fine. As long as they're moving and they can take breaks, go to the mall, sit down for a few moments and rest, get up and ambulate a little bit more, but just keep that foot motion going. Real important. Think of it this way. That's us sitting down, right? Can I suck liquid through that? Can I suck liquid through that? Sitting down, what are we doing to our vessels? We're pinching them off at the hip and knee. Standing up, we're letting the liquid flow correctly. And that goes for the arteries too. That's why your feet can all get cold when you sit and swell when you're on an airplane or you're in a car for a long time, because you're doing this. You're pinching everything off. So remember straws. We want our straws straight so we can keep moving and keep that blood flowing. Real easy to make an appointment at our office. If you look at your folder and the actual folder itself, here on the inside there's a sticker. And it's got our address and our phone number there. It's highlighted in either yellow or pink on the actual white folder. And you can call that number, and we're open Monday through Thursday. And we start very early in the morning and go till we start at 7:30. So people who like to be early and have things to do for the rest of the day can come in early. The first visit will take the longest because it is a full scan. You meet with the nurse, she gets the full history, and then you meet with Dr. Schul, who is our physician, who's been doing this for about 25 years. He is excellent at this. He is a real go-getter and a really neat guy. Anyways, you can call that number. That'll get you right to the ladies at the front desk. You can call the 800 number you'll see all over the paperwork. That takes you to our phone bank in Maryland, and you just may have to say, I need an appointment in Dothan, Alabama, if you do that. And then they'll get you set up. So either way, you can get to an appointment schedule. I'm going to be in the back here today. I know we don't have much time, but I am willing to scan anybody, and it's going to be from the knees down. I'm not doing a full scan, but just to see if I see anything. And I'll be glad to scan you. It just takes a couple minutes, so if you want to stop by and get that done, and I'll stay a little bit later afterwards. If more people want it done, I'll be glad to stay and get that cleaned up for you. I want to thank you all so much for letting me come and talk to you. Share the word, share the message, let people know there is help for them out there. There's no reason to suffer. Insurance pays.